Thank you, Mr. Chair, members of the committee, and Senator Sieben. And I'd like to recognize my own senator, Senator Coonan. If you like him, please take that into consideration. If you don't, please disregard that completely.
Roll call.
My name is Jessica Roloff, and I am a caregiver from Candiotway County in rural western Minnesota. Caregiving and being taken care of are a very intense, emotional, and private experience. If I get too emotional or not emotional enough, I hope you can look past it and hear the story I'm trying to share on behalf of so many people. Yesterday, someone was living a fairly normal life with a regular routine. Maybe the call came in the middle of the night, or maybe it was their child who they brought to the doctor with a terrible headache, or their husband was taken to the emergency room after he passed out briefly at work. But today, these people all wake up to a new world. A medical crisis has pushed them into their new role as caregiver. For some of us, it's a child. For others, a spouse or sibling. For many of us, it will soon be a parent. For me, it was my grandmother. She called me in the middle of my workday describing symptoms of a minor stroke. During her hospitalization, it also became clear that she was in the beginning stages of Alzheimer's disease. I didn't know it then, but I was about to take primary responsibility for her for the last 6 years of her life. That is why I am here today asking that you think about us. Your constituents trying to do our best to do the right thing and take responsibility for the people God has entrusted to us. We need access to a system of comprehensive, intermittent paid family leave. Caregiving is a marathon, not a sprint. As caregivers, our lives become almost inseparable from the person we are responsible for. We are surrounded by doctors and nurses and maybe a social worker, but we as caregivers are responsible for absolutely everything else that person can no longer do for themselves. We become experts in physical therapy, occupational therapy, blood pressure, bowel movements, insurance negotiations, and medication adjustments. We learn the lingo and how to use the new equipment that invades our lives. We are the communication and transportation link between medical professionals. Each new EMT, doctor, nurse, care assistant, and care facility needs you to help them understand the situation and the needs of their patient. As caregivers, we fill in the gaps. When the patient cannot advocate for themselves, we are there. Even the best medical providers will not know everything about a patient, such as she had surgery and cancer on the left side and has no breast or lymph nodes and needs her blood pressure taken on the right arm. Or she has been deaf in her right ear since age 7. If you want her to hear you, it works best on the left. When the patient can't communicate, we can often tell what a grimace or half word means. We speak the language of our loved ones, and healthcare professionals need us. We spend countless hours in waiting rooms, treatment rooms, and surgery lounges. We assist in x-ray, lab, and at follow-up appointments. When it is needed, we sleep in the chair next to the patient's bed in the hospital. We prevent falls, IVs from being pulled out, and wounds from being pulled open. The medical system could never absorb the countless hours of unpaid care that family members provide. What this bill would do is help us to meet those responsibilities. We could take a day off to go to the doctor without fear of losing our job or losing our health insurance or our homes due to overwhelming financial burden. Please give us a chance to contribute to a system that can keep us afloat long enough to survive the crisis and plan for another day. Many of us are women, and many of us work without paid sick or vacation leave. This plan would be a lifesaver, and for many, it would provide us a little more time with our family member in the last month of their life. Often by the time we get to hospice care, our paid time off and savings is exhausted, if we had any of it to begin with. The examples I gave in the beginning of my testimony are all real people that I know and care about. My friend Monica got a call when her husband fainted at work. This led to years of struggle with cancer, a bone marrow transplant, and eventually his death. In the final weeks of his life, this past Christmas, she was on Facebook asking if anyone could come and sit with her husband during the day because she was out of time off. I think as a state, we can do better than Facebook. The kid with the terrible headache is a tractor-loving, super helpful 17-year-old young man from my family church. He is currently at home on hospice. After a long fight with cancerous brain tumors, As we sit here in this room today, his parents are struggling. They're making a decision between work and being by his side. The caregivers I have known are people of great hope and faith. We believe human beings have value and that their lives have potential and meaning until their last breath. They are not patients to us. They are people we know and love and remember what life was like before the sickness. We believe in God. We lean on him frequently. We believe in miracles. But we also believe God wants us to help one another. Because of my experience, I am often asked, what is the most important thing in long-term caregiving? And my response is that everyone works as a team. We are asking the state legislature to join that team. Help us to live up to our responsibilities. Help us to help one another. And thank you very much for hearing our stories today.
Mr. Chair and members of the committee, I'm here today to share my story as a wife, mother, and caregiver who knows firsthand how important paid family leave is. I shared part of my story with you last year at last year's hearing, and I'm here today to finish what we started, but I need your help to make that happen. My husband and I have 3 children, a 6.5-year-old daughter and 4.5-year-old twin boys. My husband was in the hospital with ulcerative colitis while I was pregnant with our twin boys, caring for our daughter, and working full-time as sole financial provider and insurance carrier for our family. I developed severe preeclampsia from the stress of caregiving and endured a traumatic C-section, an emergency C-section. Our boys were delivered early and were in the NICU for 10 days, and my blood pressure remained stroke level for 6 of those days. Since the boys are premature, they required additional medical appointments in addition to my standard maternity leave. Many women need pregnancy leave and bonding leave so they can take care of themselves and any complications that may arise while pregnant and have the full bonding leave to take care of their child. My employer, who offers paid family leave, supported me through this hard time. Unfortunately, our son Mason, who was diagnosed with leukemia shortly after his 2nd birthday. He was hospitalized and then homebound for almost 2 months. The only time he was able to leave was for doctor's appointments, bone marrow biopsies, chemotherapy treatments, and hospital stays. Due to the treatment, he's left with little to no immune system and could not be in a daycare or public setting for some time. Again, my employer, who offers paid family leave, supported me through this time. Mason was diagnosed with leukemia during the busiest time of the year for my employer, a health insurance company. My supervisor did not put the company first. She advised me to take the time I needed to get our son stable and allowed me to work from the hospital, at home, and take the days off I needed to bring him to his many appointments. Mason's currently in the last phase of treatment and will be completed in December. My employer has gone above and beyond to support me and my family. Had my employer not been supportive, I would have lost my job a long time ago and our insurance coverage. Because of my employer's support, I was able to focus on healing myself and caring for my children rather than worrying about paying the bills. Unfortunately, other moms are not as lucky. As a mother of a child with cancer, I've met other mothers who are not as lucky as our family. In 2014, I was introduced to Momcology, a support community for mothers of children who've been diagnosed with cancer. I formed relationships with mothers whose children were diagnosed with cancer or leukemia and heard their heartbreaking stories of parents who were financially devastated by their child's illness, lost their homes, their insurance, and gave up everything to take care of their child. On top of the medical bills, many parents have to mispay their family's need to be with their kids through the hospitalizations, procedures, and recovery. I've also heard of parents who were fired or had to quit their jobs because their employers would or could not give them the time they needed to care for their kids. That's where I met Teresa Nace. Her daughter was diagnosed with cancer at just 9 months old. She wasn't able to return to daycare until 6 to 7 months of treatment was completed. So Teresa became her full-time caregiver. When her daughter was able to return to daycare, Teresa was able to get a new job. Shortly after, her daughter became sick and Teresa asked for some time off. She was told since she did not hold more of a senior position, they were unable to help her, and Teresa was not yet qualified for FMLA. She worried that she would lose her job if she took time off for doctor's appointments or hospital stays for her daughter. Currently, there's no protection for situations like Teresa's, and the system is failing those that need it most. As parents, our primary commitment is to protect and care for our children. We should not be forced into making impossible choices between earning the money our families need to survive and caring for our family members as they face life-threatening illnesses. I believe in a world and state where we all support each other, lift each other up, and all pitch in to ensure we can care for our families. We are all people that have family, children, and loved ones that have gone through a serious medical illness. We should not have to make the impossible choice between working to financially support our family and being there to care for our children, grandparents, parents, or spouse in their time of need. Let's love each other and support each other because it's the right thing to do. Please help us pass this bill and support the families of Minnesota. Thank you.
Thank you, Mr. Chair and members of the committee. I'm Todd Mikkelson, and I own a small business called the RM Group in Orono, Minnesota. I guess I'm coming at this from both the point of view of the employee and the employer. Back 12 to 13 years ago, when my wife and I were trying to get our new business off the ground, we also had a new baby girl. And although we were struggling financially, we both recognized the benefit we had in being able to spend time with our new baby. I was able to be there to help my wife with the vast amount of adjustments and sometimes scary tasks of being a new mother. And at least one of us could be there to be our baby's parent. This is a luxury many working families, most don't have, and a luxury that we never take for granted, nor do we think it should be considered a luxury. Keeping that in mind, the daunting prospect of running a new small business and being able to offer that type of thing to employees, you begin to realize that you may not be able to afford to treat your employees the way you feel they should be treated. Now, I own a very small business built around an invention of mine. My wife and I run our business, and we have one employee. And that employee is essential to our operations. If he needed a few weeks off, we could not afford to lose him. But we could also not afford to pay him for his time off. This is the plight of many sincerely small businesses. As far as running the numbers on what our investment would be to support this benefit, in our case, in the original form of the bill, it would cost us less than $89 a year. That is a minuscule price to be able to offer a valuable benefit to our current employee and to be able to compete for the best new employees possible when we follow through with our current plan of hiring more employees in the next year or so. It's like we could choose to buy our employees a small Caribou coffee once a week, or we could offer them paid family leave. Even if we had 10 employees, less than $890 a year could never buy us anything that would amount to a fraction of the value of offering paid family leave. And it's still a small price to pay for an offering that enables us to compete with companies that can already afford to offer such benefits. The burden of a company with 100 or more employees, perhaps, well, many of them have decided on their own to invest even more than this to offer these benefits because they know it's a fiscally smart investment to make. This bill would level the playing field for small businesses in Minnesota, and I believe that's a smart thing for Minnesota to do, considering us truly small businesses make up over 95% of Minnesota businesses, and we also employ more than 50% of the state's workers. That's why I support this bill, because it includes funding that will allow businesses like mine to be able to offer paid time off. With the affordable payroll insurance pool to help us afford to pay for family leave, we would be able to do just that. And it would make us able to compete for the best employees for our small business. And I do want to take an extra moment to express my deep disappointment that the paid medical leave portion of this bill has been removed. I'll quickly tell you our story. We were terrified to hire our first employee about 2.5 years ago. We hired a 57-year-old experienced electrician who was struggling to have a job that was worth his skill set since long before the recession. He's a great problem solver, and he has become invaluable to us. He's taken over the management of our assembly shop from me, freeing me up to develop more products and vastly expand our marketing and other things that has accelerated our pace of growth. His age was part of what made him less attractive to the larger companies. But to us, he's an absolute perfect fit. But because of his age, he's told us that he's probably going to need a hip replacement in the next year or two. He'll be unable, obviously, to work for a few weeks, and we'll have to hire a temporary worker. And if we pay our current employee for those weeks off, it'll cost us quite a lot more to pay him along with the temp worker. We very much want to retain our current employee, and we want to pay him at least something during his time off. This bill would have allowed us to pay both him and the temp for the price of a small cup of coffee once a week. I hope that provision can be added back into this initiative, if not now, then in the near future. But again, I, as a small business owner, see this bill as somewhat of a no-brainer. It would help us immensely, even more so in its original form, and I hope it will be supported by this committee and ultimately by this legislature. Thank you very much.
Thank you very much, Senator. Members, my name is Cam Winton. I'm the Director of Energy and Labor Management Policy at the Minnesota Chamber of Commerce. As you may know, the Minnesota Chamber is comprised of 2,300 businesses across the state. And between them, our employers have 500,000 employees. So it's an honor for me today to speak on behalf of the Chamber member businesses. You know, it's not easy to follow that testimony. Genuinely, thank you for sharing that. And I think hearing that testimony reminds us that we are all on the same team as Minnesotans, as human beings. We all have people who we have to take care of. As the testifiers were sharing their intimate family stories, I was thinking of my own grandfather and how before he passed, I would drive all over the country because he couldn't fly anymore, but by gosh, he was going to be at the family weddings and the graduations. And so I was the designated person to drive him. I'd fly to wherever, pick him up, rent the car, drive him elsewhere, attend to his diabetes. I think every person in this room has a story they can share of the time and energy they've spent taking care of a loved one. We share the goal, as the Minnesota business community, we share the goal of giving Minnesotans the time they need to take care of themselves and take care of their loved ones. I want to say that again because I think that's really important to remember today. We share that goal. The question then becomes, how do we achieve that goal? How do we achieve that goal in a way that enables a healthy Minnesota economy for all Minnesotans? And respectfully to Senator Sieben and the advocates for this bill does not achieve that goal. This bill presents at least three things I'd like you to think about today. The first is that it is a one-size-fits-all mandate that smothers flexibility. You know, Minnesota employers, I think, are pretty darn good. Between them, they have 2.9 million employees. There are 2.9 million people employed in the state of Minnesota today. And 75% of the leaves that those employees take are compensated in some form. That number comes from page 3 of the advocate's own report that the Humphrey Institute did, the Humphrey School did. So 2.9 million jobs, and 75% of the leaves that those employees take are compensated in some form. That's pretty darn good. Sure, there's room for more coverage, but that's pretty darn good. And what that number reflects is the wide variety of types of workplaces that exist around our state. You know, I've been calling folks off the hook, and they've been calling me off the hook to share perspectives on this topic. And Senator Sieben, genuinely, I tip my hat to you and the advocates for sparking important conversations about leave, about how we can make sure that all Minnesotans have the time they need to take care of their loved ones. The one thing that I hear consistently from all employers is that their employees are the most important thing in their business. And that each workplace is tremendously different. Picture an accounting firm in the West Metro. Picture a hospital down in southern Minnesota. Picture a poultry processing plant in central Minnesota. Incredibly different workplaces. And so what each of those workplaces and others have done is work out the approach to leave that works for that workplace. So some employers offer more PTO than other employers. Some employers offer more paid leave than other employers. Some employers offer ways to bank it that's different than other employers offer it. In contrast, what this bill does, though, is squelch that creativity, squelch that flexibility with a one-size-fits-all solution that mandates that employers and employees must pay into a fund, must pay a certain amount. If an employer wants to opt out, the employer must open its books to the state for inspection. That the employer must retain records for up to 4 years to prove that it was doing right by its employees. Members, that's not consistent with the great way that Minnesota employers treat their employees. Also, the benefits that this bill, even in its revised form, provides for are wildly out of market. They provide for up to 80% wage replacement for up to 12 weeks. In the other states that the advocates acknowledge are the closest analogs to this proposal here, we see wage replacement of up to 66% for up to 6 weeks. So this is a one-size-fits-all mandate that squelches creativity and squelches flexibility. Let me turn to the second thing I hope you'll consider. And that's that this bill is a recipe for administrative disaster. You know the Harry Potter books? Maybe you've read them with your kids and your grandkids. And in the Harry Potter series, you cannot say the word Voldemort. He is such a bad dude that you cannot even say his name. And around these parts, Minshore is that word. I've heard it said that you can't even say the word Minshore because its implementation, its design, its execution was such a debacle. So I'm not sure why so hot on the heels of Minshore, and while our state tries to figure out that problem, we would be rushing headlong into creating a brand new IT administrative infrastructure. You know, Albert Einstein said the definition of insanity is doing the same thing over and over again and expecting to get different results. But when you compare what's proposed here to Minshore, this is even more of a recipe for disaster. The cumulative Minshore enrollment, as of now, is 245,000 enrollees cumulatively. Here, we're talking about a substantial portion of the 2.9 million employees in Minnesota and the 120,000 employers who pay unemployment taxes who would be subject to paying this. Now, I grant that in the amendment, it's a somewhat smaller number. It's still a substantial portion of those numbers. Another problem that I suggest leads this to really be a disaster in the making is the fast pace. Yes, as Senator Sieben described, there was a study that was performed. I appreciate the work that folks did to highlight important issues in our state and provide data. The problem is, though, that that study, while necessary, was hardly sufficient. There was no study done of the IT considerations. There was no deep actuarial analysis. I read the whole study, but in the back, when it describes how they came to their data, there was no mention of actuaries looking at this data. And also, respectfully, Senator Sieben, you mentioned earlier that with the amendment, the tax rates have gone down because the benefits have changed, but respectfully, that's not accurate, at least the black and white text. They didn't change. Maybe the intent was for the tax rates to change, but they have not changed. And so, members, I suggest that if we're changing the benefit and the tax rates stay the same, and proponents aren't even sure if they've changed or not, the advocates are winging it. They're winging it. And that's not a recipe for sound policy that creates a healthy Minnesota for everyone. The final piece that I would point out that shows this is a recipe for administrative problems is this idea that the paid leave system can just piggyback on top of the unemployment insurance system. Members, as you may know, the federal government pays the administrative costs that the state of Minnesota incurs in running the unemployment system. And specifically, all employers in the state pay a FUTA tax, F-U-T-A, Federal Unemployment Tax Act tax. For the lawyers in the room, I encourage you to check out 20 CFR 601.6. It dictates where those funds can go to. Those funds can go to pay for unemployment insurance costs, not paid leave costs. So this idea that we're going to be able to layer this paid leave system on top of the unemployment system and save some money thereby is not accurate. So I've shared with you how this is a one-size-fits-all mandate that ignores the flexibility and the creativity of more than 100,000 workplaces across Minnesota and all the various ways that employers provide leave. And I've shared how this is a recipe for administrative disaster. This is Minshore all over again. And in closing, ladies and gentlemen, let's just talk about the the elephant in the room, and that's politics. The leader of the DFL caucus is a good man, and I have tremendous respect for him, and he has made clear that this bill is a priority of his. So I understand and I empathize with the political pressure that some members may feel to vote for this bill. But I've had the privilege of knocking doors on campaigns and hanging around campaigns, and I know how hard you have worked to earn the trust of your neighbors and earn the seats where you sit now. I know you didn't knock on thousands of doors to then jam something down the throats of your constituents. And this bill is a recipe for you to have to go back to your constituents in an election season and say, yep, I voted for a tax on you. I voted for a tax on all employers, too. And by the way, you have to pay the tax for 3 years before anybody gets any of the benefit. That's the last paragraph of the bill you can see there. It sure looks like Mincher all over again, but we'll be able to figure it out. You have election certificates, I do not, but respectfully, members, that does not sound like sound politics to me. So I ask you to vote no on this bill, and I appreciate your time today. Thank you.
Thank you, Mr. Chairman, members. My name is Jill Larson. I'm with the Minnesota Business Partnership. I think most of you know the Minnesota Business Partnership members are generally the larger employers in Minnesota, and they generally provide very robust, generous benefits to their employees, including various types of paid leave. So our issue with this bill is not the concept, but there are some concerns with the way that it is written, even with Senator Stevens' amendment, and I will address some of those specifics shortly. But overall, we have a concern about creating a new state insurance program. The bill creates a brand new program for essentially 3 new insurance benefits. And it also creates a new claims processing system and a new appeals process, a mediation system. There's language in there for civil action, so it is a very comprehensive new bill. And this was referenced earlier, but this has never been done in any other state in the country. Only 3 other states have a paid family leave program, but as Senator Stevens mentioned, they were built on existing temporary disability programs. Minnesota, as you know, does not have one of those, so we would literally be creating something from scratch. And we have a lot of questions about what the startup costs would be. There are numbers in this bill in terms of tax rates, and we frankly don't know how they were arrived at. And so it's difficult to know what the startup costs would be because nobody else has ever done this. The state of Washington passed a paid family leave law in 2007, and they frankly have been struggling with figuring out how to fund it ever since. They have a task force right now that's continuing to study this. But I know in the U of M study that was referenced, there is a section in the study that talks about that the Minnesota UI staff looked at the Washington state fiscal note, and they said that while it provides a good general map, Minnesota UI staff suggests that the Washington has significantly underestimated the costs of developing the new claims processing infrastructure. And in Washington, I've seen a fiscal note of $1.2 billion over a 2-year period for their program. And the Minnesota UI staff, I think, is saying, we think that's underestimated. So we're really concerned about the cost because our members are going to be the ones paying for this. The benefit level was mentioned earlier. Our members provide very generous benefits, but the proposal calls for 12 weeks of paid leave. That is twice the highest amount in the 3 other states that have it, and it's frankly above the market for a private employer. So that is a concern. Obviously, the payroll tax is a concern. This would be a new tax on both employers and employees to pay for a benefit that is already provided to a certain extent by most employers. But if you don't meet the bar that's set in the bill, which is a pretty high bar, you are going to have to pay in anyway, both as an employer and as an employee. The bill calls for the tax to start 2 years before any benefits are offered. So you're going to be having employers and employees paying in a new tax for 2 years with no benefit. And we just have some questions about how the tax rates were calculated in the legislation and what information or actuarial work was done to get there. The amendment changes the benefit set, right? It takes out the medical leave, but it also substantially reduces the pool of employers and employees that are going to pay in because you're carving out small employers. And so, but the tax rates are the same. And so we're wondering, you know, and we're concerned because the tax rates are a certain amount in the bill, but we don't know, is that really going to be sufficient? Because you're changing substantially the benefit set and the pool of people. And we're concerned that if the rates are low, that they're going to be raised in the future. And so there's also language in the bill that allows some employers to opt out of one or both of the benefits. So again, it calls into question, how was it determined to come up with these tax rates when you don't know yet which employers are going to opt out of which benefit in the bill? So that's a real concern. I appreciate Senator Stevens' amendment that took out the alternative tax, even if an employer opts out of the program. We appreciate that, but frankly, the opt-out, the bar is still way too high. Most employers would not be able to opt out. And the proposal also doesn't account for increased costs to employers that are going to have to replace labor. And the final thing, and this is really a big deal, complying with the Family Medical Leave Act right now is complicated and costly for employers. This bill is not consistent with FMLA. Even if it was, there would still be substantial administrative costs and complexities for those employers that currently offer a benefit, which is most of my member companies, but would also probably be forced into the state program. They are going to have to coordinate their existing benefits with the new state benefit. And the experience that some of my members have had in the other states that have this, it is costly, it is complex for both the company, and we have heard that some employees don't really like it because it's confusing to file a claim. They don't know if they go through their employer, if they go through the state. And so it's not an easy deal, and it will add costs without probably providing a whole lot more benefit. So, Mr. Chair, I apologize for taking so much time. I just think that this bill needs quite a bit more work, and appreciate your time. Thank you.